Good morning, everyone. We are from Group 8, and today our topic will be on T2 relaxation in MRI. The topics that will be covered by me, Ojai, will be on the overall view of T2 relaxation, definition of T2 relaxation, mechanism, T2 decay curve, and how the time length of TR and TE affects the image produced. Well, now we'll be explaining on dark and bright on T2, pros of identify T2, T2 weight contrast, and some case study. So now we'll be talking about the overall view of T2 relaxation. T2 relaxation is also known as spin-spin relaxation or transverse relaxation. T2 relaxation has longer repetition time TR and long echo time TE as compared to T1 relaxation. We will discuss about this later on. So now we will discuss about the definition of T2 relaxation. T2 relaxation occurs when magnetization happens in XY plane decays towards zero in an exponential fashion due to coherence of H nuclei. So you must be wondering, how does the mechanism of T2 relaxation works? Firstly, radio frequency pulse, or known as RF pulse, is turned off. That's where the position of H nuclei is at transverse at high energy state. Through T2 relaxation, H nuclei will return back to longitudinal position and at low energy. T2 wave imaging is known as spin-spin reaction is because of as the protons are flipped by 90 degrees, there is a magnetization happens across x-axis as they flip and pair together. So now we'll be talking about T2 decay curve. It is where every magnetization will eventually lose or decay. It will be returned back to the normal. T2 is the point where the image will be produced and we will be able to detect difference during that recovery. And this is where it is known as T2 relaxation time. So now we'll be discuss about how the time length of TR and TE affects the image produced. T1 image is produced through short TE and short TR, while T2 image is produced through long TE and long TR. From the image we can see the big difference. T1 image, the water is dark color while the fat is appear as white color. While in T2, the water is appear in bright color while the fat is appear in darker color than the water.
First of all, I will talk about the tissue's characteristics on T2, which is 2, it's dark and bright. And then I will talk about the advantages of T2 on MRI and its detection of the diseases. And then lastly, I will talk about the T2 weighted contrast. So first, as we see here, we have two tissues characteristic, dark and bright. This is the most important two, and which I'm going to talk about it. There are some, another one, it's intermediate, and another. First, dark is refers to low signal intensity of tissues, such as shown here, protein, rich fluid, dense bones, air, blood, cortical bones, fibrous tissues, and also fluvoid, low proton density, and calcification. Bright is the opposite of dark. It refers to high signal intensity of tissues, such as the edema, the tumor, fat, water, infection, inflammation, and a lot of things, and CSF also. The importance of T2 in MRI, which it's help MRI to detect a lot of disease in human bodies, such as degenerative diseases. And degenerative diseases is the intervertebral disc mainly consists of nucleus and cartilage and plate. It's degenerate. It's affected by robust factors and physiological degeneration. And degeneration also can result in altered biochemistry. And also we have a non-functional kidney, and also have displaying urinary tract in children. And also it helps in imaging assessment of small lesions such as iron deposits and microbleeds. And by the way, iron deposits is present throughout the human body in tissue cells and is indispensable to human survival. However, the abnormal deposition of iron can disrupt the balance of iron homeostasis. And also iron deposition is common in clinical disease such as chronic liver disease and chronic anemia. Here is the graph of the T2 weighted image contrast. As shown in the graph, first in the short of echo time, the signal difference between tissues are small, here between the fat tissue and CSF. And in the as we going or as we running in the time, the signal difference between the tissues become large in the long echo time. And here is the definition of T2 weighted images. It's reduced by using a longer echo time and repetition time, and the contrast and brightness are predominantly determined by T2 properties of tissues. And also the longer the echo time, the greater the loss of phase coherence in transverse plane, the more T2 weighted image will be. And here, as seen in the graph, the T2 weighted and long repetition time and echo time. In the repetition time, it's 4,000 milli per second, and for the echo time, it's only 90 milli per second. And we have some case studies to mention about. I have two case studies. First of all, first one is this one, first case study. It's the T2 weighted images are more sensitive to subtle white matter alteration. And it's provided and it provides a good contrast between CSF and the brain tissues, as shown in the picture. Here in the picture, we have the intermediate signal, as I mentioned before, and we have the dark and bright, the most two common characteristics. For the white matter, gray, it's in the intermediate signal, and for the bone, it's the bone dark, and we have the low signal. And as we know that CSF is a bright, so it have a high signal. For case 2, it's how to determine vigorous flow of blood. Presence of increases fluid in diseased tissue, which result in high signal intensity, as shown in the image side here in this arrow, this one. And also the fluid containing lesions such as cysts and hemogens are recognized on T2 images by their high signals. But cysts containing hemograph or high protein levels will often appear dark on T2 images, as shown in the picture. And also using a different pulse sequence with longer echo time or rebosting the patients allows the determination of pathology. And also normal signal intensity for muscle is the homogeneous gray. So until here, we finish our presentation. Thank you very much.